This AGM reports on the 2020 April flexibility report by 22. As an integrated care board, our role extends beyond delivering against our purely NHS responsibilities, but being part of a wider leadership and organisational community that works at a system level. As chair, I have wanted those we work with to see the ICB as a very different organisation to any that has been before. A different organisation, a different world, doing things differently. A catalyst, working with our local authorities, district councils, the voluntary sector, and many others to improve the health and well-being of our communities now and in the future. I think it's fair to say that our first year has been tough. More tough than I expected. We've had to respond to and confront challenges at a local, regional, and national level, of course. I knew that we'd have to fundamentally reinvent what came before us to engage and hopefully inspire people, many of whom have not had time to fully recover emotionally, physically, and psychologically from the COVID pandemic, and the organisational changes that came before and since the pandemic. Again and again, I've asked people to put aside what they think about the NHS in Kent and Medway, to set aside their scepticism, and in many cases their cynicism, to give us the benefit of the doubt, and to give us the time we need working with others to be part of the change we all want to see. Of course, we can argue that we have been trying to do this with one hand tied behind our collective backs as we wrestle with the growing demand and the limited supply of resources, be that people and money. But to a degree, I expected that. What I didn't expect, of course, was the ongoing NHS industrial action or the requirement for us to reduce our running costs by 30%. But despite all of that, we have made progress this year. Of course, not as much as all of us would like, but enough for me to know and to be able to say here today that I do believe that we are definitely on our way. Our direction is now clear and our resolve is strong. This year, the NHS celebrates its 75th anniversary. We also celebrate 75 years since the arrival of the Empire Windrush. These are two huge milestones, and I'm sure that I'm not the only one here that have taken a moment more than once over the last year to reflect on what these mean for me. I've shared the impact and the influence of both on my life and those who are important to me elsewhere, so I won't repeat myself. But suffice to say that both motivate me to hopefully make a positive difference personally and professionally every single day. I am conscious, Mark, that I've run over my time, or I'm about to. I've got 1 minute. Okay. But I really want to say a few thank yous. Can I start by thanking the thousands of NHS colleagues and others right across Kent and Medway who do such an amazing job in what can be only described as difficult circumstances. Can I also thank the organisations, be they our local authority, district councils, the voluntary sector, emergency services, and many, many others who support the NHS every single day. And without them, we could not succeed. Closer to home, can I thank our board and ICB colleagues for their support, dedication and hard work in this, our first year. And finally, can I thank our Chief Executive, Paul Bentley, for his outstanding leadership of the ICB. Paul and I do not always see eye to eye. That will please you to hear between Chair and Chief Executive. But what I can say over the last year is that Paul has been the driving force behind the undoubted progress we've made as an ICB.
Thank you very much, Sally. It's nice to see that film again, and you're only 2 years older, and it was filmed in October, so that was really good, isn't it? I'm delighted to add my welcome to you to say thank you very much for coming. Thank you very much for listening. We genuinely want to get through the presentations and have the questions and answers at some pace, because that's where a lot of the value will be. So I'm not going to speak for an enormous amount of time. But I do want to stress some things, and I absolutely pick up where Seti left off. So we have to recognise today that this is a reflection on 9 months of work. The Integrated Care Board came into being through the legislation that was passed in July of last year. And whilst picking up Seti's point that there's a bit of licence, the emphasis in the annual report, the emphasis of today is about looking at those first 9 months. So in an organisation that started 9 months from the period that we're covering, what we have done is we've spent a lot of energy in trying to create an organisation, but it's really important for me to highlight that it's a different organisation. When I talk to people about what I do, they say to me, oh, so are you the CCG by a different name? Are you assuming the CCG powers? And the reality is they're very different. The way that CCGs were constructed, the governance, the legal mandate that they had is very different for integrated care boards. And it's been a year when we've tried to reflect that and tried to build on it. And very much to my point on this slide, we aren't a replica of what's gone before. We pick up some of those determinations and those decisions, but we recognised, and the reason that Seti and I and the rest of the board came into this role was to be different and not to pick up the same mistakes of the past, but to build for the future. So very explicitly and very deliberately, what is an ICB? An ICB, our ICB, this is local to Kent and Medway, serving about 1.9 million people. Ivor was reminding me, spending £4 billion a year of taxpayers' money, very large sums. We exist to improve the health and the healthcare, as you heard from Kate in the video, of the people of Kent and Medway. And we think that it is important that we do that as a leader working with our partners, and they are multiple partners across Kent and Medway, to make Kent and Medway a great place to live, work and thrive. And I would absolutely emphasise the point that you heard in the video, that the NHS is 75 years old this year, but where it is really clear is that health is not made better by healthcare. Health and good health and enjoyable health is made by all the things around us. And you will know some of this data, but it is so shocking that I repeat it frequently. In an ICB where you can drive from the top to the bottom or the side to the side in an hour and a half, depending upon where you are born, you will live 18 years longer than the people who will live the shortest in Kent and Medway. That is a huge variation in life expectancy based upon where you're born. This is included, and it's a very busy slide, but it goes to the issue, and this is on our website and this will be in the pack, but this just explains where ICBs fit, because they're new organisations. I'm not going to go through this consciously, but people ask me repeatedly, what is an ICB? How does an ICB operate? Where does it fit within the system? The part that I would highlight is one line down. On the left-hand side, an integrated care board, an ICB, the organisation which tonight it's having its annual general meeting, and equally important on the top right-hand side, the integrated care partnership, which is a statutory coming together of 3 organisations: NHS Kent and Medway, Medway Local Authority and Kent County Council. And the ICB will not succeed if we do not engage meaningfully with those partners and if we don't jointly drive the agenda that we're talking about. So if we just pick up at that point, and you've heard some of this, but it's important to reiterate it. What we've done in the first 9 months of our existence is we've come together, we are having those meetings, we're having those discussions, and we are meeting with the statutory partners. The Integrated Care Partnership Board meets in public. You can watch it on video, you can go back through the old versions and see it. What we've also done is we have continued to delegate to 4 health and care partnerships, what we refer to as HCPs, which are geographical parts of Kent and Medway. In Kent and Medway, we have 4, as I say, we have East Kent, West Kent, Dartford, Gravesham, Swanley, and Medway and Swale. And what we are trying and working hard to do, and when you go through the papers of our board meetings, you will see we are working to delegate authority and money and license to operate to all of those 4 health and care partnerships that bring together the NHS, local authorities, the voluntary sector, and really importantly, the patient voice. We're also doing things in an area called provider collaboratives. Provider collaboratives are where parts of the NHS and broader come together and operate as a system. And we've had some real success. We have a provider collaborative in mental health, learning disabilities and autism, where we've done some good and innovative work, which has made a difference to people suffering and enduring mental health illness in Kent and Medway. And we're working to expand those, particularly around urgent and emergency care. And just finally, on this slide, and really importantly, everything that we are trying to do is done against a basis of making things sustainable. We are not going to take short-term fixes and take short-term decisions that will leave us with a bigger problem later. We are trying to drive a sustainability agenda on all levels, financial, workforce, and pure sustainability in terms of decisions we make. The list here is just important, and it builds on the point that the chair made around what our priorities are. These are the priorities for the coming year, and I just want to highlight a couple of them because I think they're very, very important. Second up from the bottom, primary care in Kent and Medway delivers tens of thousands of appointments every day. Over 80% of what the NHS does any day of the week is delivered in primary care. And the premise that we are building from in the Integrated Care Board is that without good and strong and reliable and accessible primary care, the NHS in Kent and Medway will not succeed. The other one that I would just want to highlight on this list is the very bottom one. The NHS in England employs just under 1.4 million people. At the moment, we are grappling with a situation where the NHS in England is carrying about 140,000 vacancies. Chair alluded to industrial action on an unprecedented scale in the NHS, and we have been grappling with that for most of this calendar year, and we anticipate it will continue. Without our workforce, without us providing attractive jobs, without us providing careers that people would want to work in, we will not have an NHS. So quite rightly, one of our priorities in Integrated Care Board is to make sure we have the workforce, we keep the workforce, we create attractive jobs to make sure people stay and work in the NHS. There is an absolute priority on performance. And the reason that I put this slide in, and I won't again be driven by it, you're going to hear from people much better served than me about things like blood pressure and how we've changed blood pressure. But as at early this month, across Kent and Medway, we have over 200,000 people who are awaiting for elective care. Now, the Integrated Care Board serves 1.9 million people. It is growing. Kent and Medway is becoming an increasingly popular place to live and to work. So 1 in 10 people in Kent and Medway are waiting for an elective operation. We've worked really hard through the team in the 9 months that we've existed to drive down some of those numbers. We are now at a point in Kent and Medway where only handfuls of people are waiting for the longer waits that we were seeing out the back of the pandemic. But one of our absolute priorities is to make sure that performance, numbers of patients waiting, for elective care, for emergency care, for the ability to get an appointment in primary care, that is something that we'll continue to work on in this year, but we've made some headway in the year that we've talked about thus far. I talked about primary care. Primary care is something that I get the most questions about. It is extraordinary. So we have made some progress, and sometimes the issues about primary care can get lost in the noise. So I just wanted to share some of those. The NHS across England created something called ARS roles, additional roles that work in primary care, and examples are given here, which is advanced practitioners, physiotherapists, pharmacists, counsellors. In Kent and Medway, and this slide would be slightly higher in terms of the number now, but when we produce this slide, 795 additional full-time roles are working in primary care because of some of the changes we've made. And what that means is that when you phone your GP practice to get an appointment, the GP practice may well say you would be better off seeing a physiotherapist because you have an MSK condition. You might be better off seeing a pharmacist. And those are real roles which are live now in Kent and Medway. 96% of The GP practices in Kent and Medway are now live with the ability to talk digitally to the community pharmacists that they operate with, which means that you may reduce the amount of time that a patient has to spend in their GP practice. That's really important. We've piloted in some of the most challenged areas of our county and our ICB an approach that meant we would enhance the ability to recruit and retain general practitioners. Those are broadly or to the north of our patch. And what we've done is we've put in place schemes to attract and then to retain additional numbers of GPs, and they are small numbers that they are beginning to bear fruit. And that's really important. And just in terms of numbers, we have significantly increased, and you see the numbers here, we have significantly increased the numbers of appointments that are available within primary care. Not all of those are with a general practitioner. Some of those will be with a pharmacist or a physiotherapist or a counsellor, but there are more appointments available. And the feedback from the public is that once they get into that system, they are getting good service. But we will continue to work on that, and we will continue to prioritise that because we know that primary care is central. Slightly reiterating appointments that were made. What we've done in this year covered, we've signed off our draft integrated care strategy. Really importantly, we've defined our forward plan. We've built our system leadership. But as Sedi mentioned, this was the year in which the NHS turned 75, and it was really important to recognise that and to celebrate that. And there was a series of events. I just close this section, and then I'm going to hand on by adding my thanks to everybody who works, who volunteers, who provides their time in the NHS in Kent and Medway on such a huge scale, to thank our partners, to thank the staff in the ICB and our board, and to say it's been a year of building, and the year that we will report on this time next year will build on those advances and take those advances further. And a final thing, which is just a plug. You saw mention of the symposium that's been touched upon. There will be a symposium next month in October, and we would invite everybody who can and who can make a contribution to come and engage in that process as we continue to build that process. Thank you very much.
So thank you very much. Thank you. So this is an unusual one for us, as has been touched on throughout the meeting so far. This is for a 9-month period for the ICB. So big thanks to my finance team that did 2 sets of accounts last year, one for the CCG for 3 months, and then the ICB for 9 months. They're absolutely amazing. Thank you very much. For the ICB itself, we didn't quite achieve a break-even position. We agreed a deficit position with NHS England at year end of £6 million, which means that we did get a qualified opinion for that. However, it was fully agreed by NHS England. Everyone was aware of it, and as were the board. So it was, other than that, a good, clean accounts audit and built on for the second, the CCG piece of work that my team went through. So positive in terms of where we were and where we got to. Next slide I want to take you through is where we spent our money. Again, some of this, because of the 9 months, you might not be able to do some of the comparisons you might want to do. Highlight a few things for you. So yes, we took on pod services, podiatry, optometry and dentistry. So our spend in primary care increased substantially by about 13%, but within there are some hidden numbers. So we did increase spending on GP primary care by 9% in year. So some of the comparisons might be a bit challenging, but happy again later on or offline to pick up some of where we've changed our spend and how we're spending it. Put in the next slide a nice picture for you, because apparently just words and numbers aren't very exciting. They are to accountants, but we've just put a bit of a slide up with some diagrams that you can see in our annual report. So our priorities from last year in terms of the pressures that we had to deal with. So financially, it was a challenging year for us. We'd come out of a couple of years of COVID when there was significant investments in the NHS, and we were absolutely focused on delivering the best outcome almost at any cost. We've then come back into a new world, back into the world of NHS finance, where we had a single control total as a system, which is a real positive. The move to the ICB and the whole system being held to account to deliver that single control total as a system when we're all responsible with each other for delivering outcomes and finances for the NHS and the population. But we did have to recover from the impact of COVID operationally and financially. So we were driving to deliver more activity, and we did really well in terms of the delivery of, Paul touched on it, on elective and outpatient care, as well as responding fantastically in terms of urgent care. But on top of that, we had that significant change in the focus on efficiency and productivity. So in that period, our costs have gone up. We talked about the number of staff. We're employing about 20% more people than we did a couple of years ago, but our productivity and work hasn't been the same. Kent and Medway stood out as a positive, actually, in the national benchmarking, and we need to continue and drive that as we go forwards. And as with everybody else last year, there were significant inflationary pressures that we had to manage. So the fact that we delivered the agreed control total with NHS England is a really positive message for the ICB. I'm not going to overrun my time. So looking ahead into 23-24, Paul mentioned we now spend £4 billion a year on services in Kent and Medway. We are one of the few systems that did receive a deficit control total as a system, with NHS England supporting us in recognising that we've got some challenges we have to overcome. And it's really important to recognise that whilst we've got a control total that's a deficit, we are, as a system, looking to deliver over £250 million worth of savings and efficiencies. Some of that is through just doing more work for the same amount of money. Others is looking at how we can take money out and do things in a different way. We have a number of significant challenges. I talked about electives. We've now stepped up to one of the highest targets nationally for electives, 109%. We're over delivering that. We are unusual. It's a really positive message that will bring more money into Kent and Medway to pay for services. As we deliver above the 109%, we get more money and can treat more patients. And we are sometimes feel uncomfortable as a finance person, just go for it. What else can we do using all the capacity we possibly can? But there's a real thing for us, building on the knowledge and experience through the last 2 years. I've been on the journey from the CCG into the ICB, and the real stark difference on how we work as a system. As a finance community, we talk a lot about system first, how we get the best for populations and patients in Kent and Medway, using pounds as an enabler, but you see it across everywhere. We moved more patients last year to other hospitals for their treatment, so we shorten the waiting lists than we've ever done before. A real system approach to everything we do. So we need to make sure, as we've touched on before, how we lever the benefits of that integrated care system. We work across all of our partners to enable that. I'm finished.
Good afternoon, everyone. My name is Natalie Rennie. I am Senior Programme Manager within the Primary Care team. And today I'm here to talk about hypertension case finding and management across Kent and Medway and introduce some really great schemes that are focusing on this priority piece of work. So what is hypertension? In a nutshell, hypertension is high blood pressure. It is when the pressure in your blood vessels is unusually high. It is measured with 2 readings, a diastolic and a systolic reading. And as a general guide, any reading which is 140/90 is considered high, and that's high blood pressure. The threshold changes ever so slightly for those who are age 80 and over, and it moves to 150 over, thank you, over 90. So why are we talking about high blood pressure today? You know, why is it so important to understand about hypertension? Well, there's 1 in 4 of us that most likely have it in England, whether you know about it or not. It's the 3rd biggest risk factor for premature death and disability. And those from deprived communities are 30% more likely to have high blood pressure. At least half of all strokes and heart attacks are associated with high BP. So again, this just shows why it's so important. Now, high blood pressure, there's not necessarily any symptoms. The only way you would know about it is by getting it checked. But there are some risk factors associated, which include older age, lifestyle, including being overweight, obese, high salt intake, and too much alcohol. Thankfully, there's lifestyle changes and medication that can really help, and medication available from general practices. Now, acknowledging that it is such a priority, both nationally and locally, we have a set of really ambitious targets that are absolutely achievable. So what we want to achieve by March 24 is to increase the percentage of patients with hypertension treated to NICE guidance to 77%. That increases to 80% by 2029. And we really want to double down on our efforts to try and diagnose 80% of the expected number with hypertension by 2029. So all of those efforts, as we know, will reduce our cardiovascular events, and it's really important that we seek to do that. This diagram, created by our UCL partners, really demonstrates the benefits of BP optimization in preventing heart attack and stroke. And I'm going to talk you through it. So if we start with our baseline position in March 20, we were just under 68%. Now, we all know about COVID and the disruption that that caused across not only our system, but other systems in the country. And that just dropped for us to about 43% BP optimization. Over the last 3 years, we've been in a recovery period and we've climbed back up to nearly where our baseline is. But actually now there's a real opportunity for us to go beyond where our baseline was and go beyond the historical suboptimal treatment. So we've already mentioned around our ambition for 77% for this year. Now, what does that really mean, 77% in terms of saving cardiovascular events and, in helping patients improve their outcomes? Well, in addition to the work we're doing, we're estimated to save 189 heart attacks and 282 strokes over a 3-year period if we were to achieve that ambitious target, which not only helps the patient, but there's some real significant benefits for the system as well. So I'm going to talk a little bit about our current position and where we are. So I've mentioned the impact of COVID and the disruption. But actually, we have done really, really well as a system over the last year in terms of hypertension treatment to target. Looking at June 22, you can see the significant gap between us and England. What we have started to do is really close that gap. And we're going to continue to work towards that 77% and cross that blue line. That is the aim. We're currently sitting at 66.2%. And a lot of this improvement is all attributable to a range of interventions, projects, and digital tools that have become available across the system in the last year. And I'm going to talk you through some of those. It's also worth noting, actually, that us and Surrey and Sussex were the fastest improvement system in the country. So really, really great work here in Kent. The part of improving is BP checks and knowing who has hypertension. So this is one of our initiatives that we have that focuses on case finding. It's a joint project. This is the Hypertension Heroes. It's a joint project with Medway Council, NHS Kent and Medway, Office for Health Improvement and Disparities, Kent Community Health NHS Foundation Trust, EK360, and the British Heart Foundation. So a real system approach. The initiative recruits volunteers to work with communities who perhaps don't have the same opportunities to engage with health services and are more at risk of high blood pressure. To date, they have 57 volunteers working in these communities, and 2,468 people have been supported to measure and understand their BP. A third of those engaged have reported that they are going to make lifestyle changes going forward. So that's just some of the outreach work that's going on. But general practice play a significant role, not only in case finding, which they do quite regularly through opportunistic checks or ongoing management for specific long-term conditions, many of which is actually through a face-to-face appointment. But one of the new initiatives, which is supported by digital tools available to general practice, is that they're inviting patients to submit their BP readings via the NHS app and SMS, which, as you can see on screen, this is what it would look like. They are also directing patients to health pods, which is available within some practices and other local settings across Kent and Medway. So to give you an idea of some of the numbers specifically, in the last 7 months, so March to present, patients have been invited to submit their BP reading via the app and SMS. And we have had 47,000 blood pressure readings submitted back to general practice, all of which is reviewed by a clinician and all of which goes into the patient's health record. Those that are then subsequently diagnosed or as part of an ongoing management will continue on that pathway with their clinician. So it's a really great tool going forward, and it's such a fantastic achievement within general practice. Community pharmacy. Now, community pharmacy are developing a range of services, one of which is the community pharmacy blood pressure check service. It comprises of 2 parts. So one is opportunistic blood pressure for those aged 40 and over, or those directed from their GP. And then the other is ad hoc checks as well. So as you can see from the pins here, they're dotted all around Kent and Medway. And I'm pleased to tell you that we have 253 pharmacies signed up to this. In the month of May alone, they did 4,326 blood pressure checks, all of which goes back to the practices. So again, another real significant achievement. Coincidentally for us, it's Measure Your Pressure Month, which is great. So this follows on from the National Know Your Numbers campaign, which ran from the 4th to the 10th of September. But in Kent and Medway, we want to take it a step further. So we have got it as a local initiative that runs for the full month. There's lots of information about Measure Your Pressure and on our website, which directs you to various venues and locations of where you can go and access blood pressure. And we really would encourage everyone to visit the website to find out information further. We've also got a lot more information around those initiatives that I've started to describe around Hypertension Heroes as well, and their locations. The bus is not just a picture, it is real, and it's at the front of the hotel. So please do engage with them today. They're here till 7 o'clock and they're offering free health MOTs. So finally, I'd like to conclude by inviting you all to measure your pressure, not just now, but going forward. And thank all our system partners for the initiative and the work that they've done around this and the significant achievement in improving our hypertension treatment to target rates and the work that goes forward. And I hope that the projects and initiatives have demonstrated the benefits of a functioning ICS when we're trying to improve hypertension treatment to target and case finding. Thank you.
Good afternoon. I'm Matt T. I'm the Executive Director for Communications and Engagement for the ICB, and I'm going to compare the Q&A for this section of the meeting. Can I just say, for those who are joining us online, if you would like to ask a question, you need to type it into the Q&A box, which you can access by pressing the Q&A button at the top of the screen. We don't have the capacity to take oral questions from those who are joining us online, but we will take oral questions from the room. I'm comparing this because I'm juggling 3 things. We had some questions submitted before the meeting started. We've also got people in the room and we've got people online. So I'm looking to juggle all 3 of those, but I think we'll start, and I'm going to funnel questions through Paul and he can distribute them where he thinks is appropriate. I'm going to start with Paul.
my chair just said to me, make share that stage.
Okay. Well, you know, there may be occasions where it's appropriate to turn left, but you never know. But unsurprisingly, I think, and although it was covered in your presentation, Paul, quite a lot of the questions that have come in have been on a theme of primary care. And we've had several questions from the Kent local medical committee, who represent GPs, and I think we have colleagues in the room from the local medical committee. So, but also from one of our MPs. So I wonder, the question I guess is, you talked about additional roles, but clearly we're one of the most under GP'd areas in the country. What's the ICB doing to look to retain GPs, recruit more GPs, and have a more even distribution of GPs across Kent and Medway?
Does that work? Can people hear?
Yeah.
Okay,
Yep.
super. Sorry, Matt. Thank you very much. So I saw a former colleague. Sorry, certainly not an old colleague. Jack is a long-serving general practitioner in East Kent and also works with the local medical committee as one of their medical directors. And Jack and I have worked together for quite a while. To answer your question, the reality is that we have to address this issue on multiple fronts, and we have to do things for the longer term and the medium term and the short term. If I take them in that sequence, it is not often reported, but until 3 years ago, Kent and Medway was the largest conurbation in England that did not have its own medical school. And all of the data and all of the research is really clear that if you train as a doctor in a particular geography, you are significantly more likely to stay in that geography. So what we had in Kent and Medway, and we had a large number of people who wanted to train as a doctor. If they wanted to do that, the unfortunate reality was that they would leave Kent and Medway, and once they've left Kent and Medway, the chances of getting them back are diminished. So there's a first thing, which is the ICB absolutely fully in terms of endorsement and financial support, and working very closely with Chris Holland and his colleagues. Chris being the founding dean of the Kent and Medway Medical School, will continue to support that medical school. And we also encourage, and this comes more to primary care, that those medical students get out into primary care much earlier than a number of medical schools elsewhere. So they go out and spend time in general practice. And what we've worked to do is to encourage those people then to stay in Kent and Medway. So there's a longer term issue. In the short and the medium term, very much as I reflected in my presentation, what we've tried to do is to put additional roles into general practice, and those are physiotherapists, pharmacists, counselling staff, because there is a ceiling on how many people can be GPs. There is a limit. And what we have to do is we have to bolster roles and give patients access to other roles, and we will continue to do that. So the 700 plus ARRS roles that I mentioned, and what that's leading to is an increase in the number of appointments. But we've also put in place, with a lot of leadership from our GP colleagues, the ability to recruit and retain in some of the most challenged geographical areas. So my summation to the question would be, we've done some things, we need to go further, we will continue to go further. That's why primary care is mentioned in the priorities for the ICB. And what we need to do is build on that and continue to build on it until such time as the doctors that we are training in Kent and Medway will start to come through and be Kent and Medway residents who turn into Kent and Medway doctors.
And I guess a sort of related question, we had several questions about the role of pharmacies and patients being directed to pharmacies when they might have perhaps gone to a GP surgery or that sort of thing. Where do we see the role of pharmacies going, and do pharmacies have the capability and capacity to manage the role that we sort of expect of them in the future?
I'm going to ask Dr. Kate Langford to address that because she heads up our medicines optimization team.
Thanks, Paul. So very much we see community pharmacies being part of our overall primary care solution going forwards. And there's a new national initiative called Pharmacy First, which is going to expand the role of pharmacies in being able to treat a number of common but not life-threatening illnesses. This is really welcome because it gives people so many more places to go to get the help they need for minor illnesses. And I'm really pleased to say that we've got the majority of community pharmacies in Kent and Medway signed up to be able to offer this scheme now, which is really positive. And in fact, we've had over 27,000 consultations in pharmacies in the last year in Kent and Medway. So it's giving people a lot more choice of where they can go to get their care. So very much see them as part of the solution. And we work very closely with colleagues in that sector to try and work out where we can offer most to the communities that might find it hardest to access other forms of healthcare.
Thank you for that, Kate. I've got some more questions online and indeed submitted before, but are there anybody in the room who would like to ask a question? There's a lady at the back in green. Georgia, if you could if you just wait till the microphone comes, then we'll all be able to hear your question.
Hi, good afternoon. My name's Carol Stewart and I'm chairperson of Medway African and Caribbean Association. So we do a lot of work, with colleagues from public health and the NHS. We've done the Hypertension Heroes project. But one of the, we noticed that we're in an environment now where I think local authorities, NHS, the government is trying to move more towards the voluntary sector being involved in sort of delivering health services. But in order to do so, there's got to be some real investment. If you want to have diversity of choice for people, then there needs to be some real investment, and we can't keep expecting just because we're a voluntary organisation that we can do things for free or do things for half the cost that it costs the NHS. So I'd be keen to hear how you plan to address those challenges, particularly for the voluntary sector.
Thank you very much for that question, Paul.
Carol, thank you very much. That's a really salient question. To give evidence to what Carol has described, and I would passionately agree with you. We invested as an ICB just under £100 million last year with the third sector. So that's the voluntary sector. A lot of that is in very specialist areas. So the area where we spend the most is in end of life care with hospices. But I'm going to passionately agree with you. I think that there are some things that the voluntary sector does really well, and I would say it does better than other parts of the statutory sector. And we have a passionate advocate of that sector in our chair who would absolutely be supportive of that. And what we need to do is do something that, candidly, I'm not sure the NHS has always been terribly good about doing, which is to reach out and build those longer term relationships. Because the thing that I get fed back to me from colleagues in the voluntary sector is, don't come to us and talk to us about 6 months worth of money. Come and talk to us about 3 years and 5 years worth of money, because that's where we'll really add the value. So I think it's a work in progress, but I'd absolutely agree with the premise of your question. I think we have to do what you describe, and we could do it a lot better.
Thank you, Paul. Any other questions in the room? Oh, there's a gentleman back. If you just wait till the microphone comes and then say who you are, that would be very kind.
Thank you. Sorry, I've got a slightly hoarse voice. That's not COVID. So just to clear that up. So my name's Jack Jacobs. I'm a GP, as Paul alluded to, and I'm a resident of East Kent. I've lived here for 20 years, and I also represent GPs across Kent and Medway. And the thing I want to talk about or mention or question is quite difficult. It's quite challenging, but it's real, and it relates to quality healthcare and safety. And really, this is an area specific issue that GPs in this specific area have been identifying for a number of years. It's in East Kent and it's about East Kent hospitals. And we're just concerned that there are issues in the hospital around patient safety that we don't feel have been properly addressed. And what I would like to hear from the ICB, and I'm sure it's aware of this, but sometimes I think our voice as GPs, we feel is not actually listened to. And I'm just concerned that if it's not listened to, things will get missed. So I'd just like a bit of reassurance that the ICB will help us in identifying these issues so the organisation can move on in a safe and productive way. Thank you.
Thanks, Jack. I'm going to pass the mic in a wee minute to Kate, as you probably would anticipate. But there's a couple of things I would just add before I do, if that's okay. I'm not sure that all of the time, on every occasion, 7 days a week, we have got it right in the NHS about listening to people's voices. And the GP voice within that is really important, and the patient voice is really important. And there are people who I know have joined online who are advocates of patients, and that's really important. So my first observation is, I don't think you will, but please don't stop. I think you need to continue to do that. The second one is a narrow point, but I think it's important. We have not got the relationship right between different parts of the system. It is exactly what the Integrated Care Board came into being to do. And I know that the local medical committee that you work very hard for have been an advocate of the liaison work, and Kate might mention that in a minute, but that's really important to have that open dialogue and that respectful dialogue between different parts of the system. So I'll pass to Kate, but please don't stop, and we absolutely take really seriously the concerns you raise.
Thank you, Paul. People in the room may not know, but there is a real focus now coming through the whole of the NHS on the interface between primary care colleagues and secondary care, the hospitals. And here in Kent and Medway, we've set up a group, and Jack, you may even be part of that group, which is looking at those interface issues and how we work through those so that there is a good route of communication between each of our hospitals and the GPs who work in the area around that hospital. And we have two ambitions, really. One is we want to do that at the level of the whole of Kent and Medway, and this is where we're working with the local medical committee to set up a way of making sure that each of our hospitals will come to the same arrangements by and large with the GPs around it. But the second part of that ambition is that each of our 4 places around one of the acute hospitals will do that on an ongoing basis, having that dialogue between the medical people inside the hospital and the GPs outside the hospital. And indeed, 3 of our 4 places have now appointed a medical director from the primary care community around the hospital to be that key voice for primary care and that liaison to link up with the medical director inside the hospital to allow that professional dialogue. As I say, 3 out of 4 have appointed, the 4th is in process, and I think that will be a really positive step forward in creating that route for concerns to be heard.
Nick said he wanted to.
Yeah, I'm not sure if you can hear me, but I sincerely hope so. That I think one of the things that maybe goes unreported is how we as an integrated care board have developed our governance structure in order to reflect the range of voices that need to come together to work together to drive the change that we've talked about. So one of the things that we've, not just us, but coming out of the legislation, is the inclusion of partner non-executive directors on the ICB board. So we have 2 very active, busy GPs on our board, and their voices are increasingly influencing all of our thinking in the same way that we have representatives from our local authority colleagues and from our acute and mental health trusts. It's a long journey, I think it's fair to say, and that balance that Paul talked about earlier about delivering the short-term must-dos and working through and planning for some of the longer-term changes that we need to make, that's what's really exercising us. But what I can assure people here today, people who are listening, is that is on our agenda and it is not coming off our agenda. We've got to find different ways, and You know, I bend Paul's ears all the time. Paul in turn bends Matt T's ears all the time about the need for us to really ramp up our communication and engagement, find different ways to listen and have those voices influence our short-term, medium and long-term planning. It is work in progress. But what I mentioned earlier on about asking people to give us some time is to enable us to really move this super tanker that is the NHS in Kent and Medway forward in a way that we can all understand. So again, it's just to reassure people here and online, that's our commitment. Thanks, man.
Thank you very much for that, Sedi. The budget application's coming in tomorrow. So important question online. What can the ICB do to ensure that it and its partners are committed to an EDI strategy and to demonstrate measurable improvements as part of the workforce strategy with increased diversity on boards across the NHS?
I'm not going to be able to keep my chair quiet on this. So I'm going to ask Sedi, because it's something that he and I absolutely passionately agree on and are advocates of, and recognise that we're not in the right place. But what I would do, Matt, if this is okay, is that sat in the two front rows here are some of the members of the board of the organisation. So after I've invited Sedi to speak, I'm also just going to ask Becca Brad, who is our Chief People Officer, sat in the back row, and I'll get a mic to her if that's okay. And she will put some particular observations about Kent and Medway in the mix. Is that
Very
okay?
good. Yeah.
Part of my role as chair is to agitate and to ask questions again and again and again. And it won't surprise people here and online. This is something that I am completely connected to and passionate about. Based on my own lived experience, professionally, in terms of my journey, I've shared my journey with people in terms of the talks I've given. This is something that I want Kent and Medway to not just be in the middle of the pack on, but to really be a national leader. In my opinion, I think it's really important that I'm up front here. We've got a long, long way to go. There's no question about that. But what I can assure people of is the commitment is absolute. I think the challenge sometimes is to create and maintain the pathways to change. And part of our role as system leaders is to work with and influence those different parts of our NHS system, and more widely, to also have the same conversations. We're working with a whole series of sovereign organisations with their own governance structures, with their own challenges. But what I can tell colleagues, and I meet with the chairs of our trusts and others on a monthly basis, is something that we are collectively committed to. But as someone once said, there are no shortcuts to anywhere worth going. This is a long-term challenge. It's a multi-generational challenge. But again, I can only reassure colleagues that I will not stop pushing, asking questions, demanding change, and then passing the baton to Paul, Becca and colleagues right across Kent and Medway to make that change happen. But we are totally committed to this agenda.
Thank you. So I'm Becca Brad, I'm the Chief People Officer for NHS Kent and Medway, and I'm working with colleagues across the NHS on our ED&I agenda and some shared work together. So I'll maybe give a few examples of that. So NHS England have produced this year our ED&I improvement plan, and part of that is around having board objectives for ED&I, which is something that as organisations we're actively working on together to see the things that could have the biggest impact. As Sedi said, it takes some time to get some of these changes in place, but we've got some really good green shoots. Our ED&I networks are working together across Kent and Medway, putting on celebration events like Black History Month that's about to come up, that joint work that's working across organisations. We've also got joint talent programmes running, particularly in nursing at the moment, where we're starting to try and lift colleagues up that may have been blocked in the past in terms of those glass ceilings and get exposure and development and working together. So at the moment, we're sharing good practice, and there's good practice across all of our organisations in Kent and Medway, not always in the same place. And we're also working with our colleagues to understand their lived experiences and understand what are the best things that we can do to make it better for them. So I think it's a work in progress at the moment. There's lots of listening and working with our networks, and we're working towards that shared plan together going forward.
But this is also, it's not just, this is across the breadth of the equality, diversity and inclusion agenda. It's not just about race. It's about the intersectionality of race, gender, disability, of creating opportunities and giving people a real sense of what is possible and the contribution that they have to make. A word that is reverberating around virtually every meeting that I go to over the last year or so is around accountability and being personally accountable, but also being willing to hold others to account. And that's part of the culture change that we are developing within the Integrated Care Board and beyond. One of the things that's really heartened me over my time as chair here is I'm pushing an open door. Everywhere I go, people want to make a difference. Challenges, time, money, resources, energy, but that's why we talk about together we can.
Indeed. A quite specific question, but I think one which has been a theme in Kent and Medway for a bit. Blocked ears can occur for a number of clinical reasons. Why are patients required to pay for ear syringing, and is it not available at their GP practice?
I'm going to ask Dr. Langford to answer that. A better place.
So hearing loss as opposed to blocked ears is something really important, and something, if anybody experiences, we'd absolutely encourage people to seek a medical opinion on that. If your blocked ears is due to wax, then it may not be that the NHS can do the microsuction to remove that wax for you. But I think that I just want to draw the distinction between the two really important things there. Hearing loss, absolutely. But that is one particular way of getting rid of wax if that's the cause of it, and that is not available.
Thank you for that, Kate. Are there any other questions in the room? I have a couple more submitted before if there aren't. Going back to the theme of primary care and GPs particularly, Paul, what are we doing to support GPs in improving their premises and keeping them up to scratch?
It's a multifaceted answer, so forgive me, but I'm going to start and then I'm going to ask Ivor to come in to give some examples. We have to recognise that general practice are sovereign organisations, and we have to be respectful of that, because I think that is why general practice is so energetic and entrepreneurial on occasions. So we have to be really clear about what we're trying to do. But there are occasions when we do step in. So at the moment, the board is considering the development of various healthy living centres across all the parts of Kent and Medway, which will allow GPs to come together with other parties. Those are buildings which GP practices will occupy in due course and which will pay rent to. We also have situations where we've looked at the best and most efficient way to drive investment in both physical buildings and also IT infrastructure, which we put in place a number of examples of. And what we try and do, and we drive some of this work, and it goes back to Kate's answer to an earlier question, it's really important to have a primary care and a GP voice, and we have that in all of our healthcare partnerships, and they bring that issue to the table and they give us an example and indications of what the issues are. So if I rest there, Matt, but I'll ask Ivor to come in, and again, similar, Mike, who is sat down here on the front row, who leads for estates, might just give a couple of examples as well.
Very good. Thank you, Paul. So as an organisation, we work very closely with primary care around looking forward about where the areas of most need are and working with them. We work through NHS England around securing additional capital, and actually as an ICB, we've underwritten quite a few schemes where delays have come and actually costs have exceeded those initially started with, recognising the need for primary care, estate development and security. I think also, and Mike might pick up on a couple of examples, we also look innovatively at this. So Paul mentioned the business cases we've been considering around Chatham Healthy Living Centre, and also we've started the work around Edenbridge, around pulling those together in a multi-use space. So I think there's a lot more to go at, and we need to think innovatively and differently, and the range of services that we offer within those facilities. But it's forward thinking that we.
Mike, so thanks very much. I'm Mike Gilbert. I'm the Exec Director of Governance, but I also lead on strategic estate for Kent and Medway. What I'd add to that is that the way that GPs have worked historically and the ways that GPs and primary carers we've been talking about over the last hour in terms of an integrated care system is completely different now, and completely different looking forward than it probably was 10, 15, 20 years ago. Many GP practices now, and the focus of working in primary care is actually in multidisciplinary sites where community services, the voluntary sector, social care works alongside primary care within the same building, but actually working within committed services as well. So other examples in terms of where we're currently looking at the moment in primary care around how that might work in Thanet, in a particular area there, we're looking at around about how we can pull together a proposal that actually brings community diagnostics, community services, primary care services together, also in Folkestone and Hythe, as well as within Chatham as well. So there's a number of schemes in place. I think the other thing we mustn't forget is a lot of GP practices are privately owned. So actually, as Paul said, it's working with primary care to how we support and make sure that the investments that they might want to put in their own buildings are value for money for themselves and absolutely affordable as well.
Thank you for that, Mike. Any other questions in the room? There's the lady halfway back, just there.
Thank you. My name's Heather Keane and I'm a councillor with Thanet District Council. Obviously, all areas have got house building totals, and in Thanet in particular, there's a lot of concern about the level of services people are already getting and the impact that all these new houses are going to have on that. So how are the ICB planning for that, and what can I tell my residents in future to reassure them?
Thank you. Thank you very much for the question. What I can share with you, for you to share with your residents, is that the reason that we put in place a 5-year plan was to do that planning. And the reason why to the ICB, the ICP, the Integrated Care Partnership Board, which works with the 2 upper tier authorities, is so important, is that forward look. And one of the things that we are doing, and there's a crossover here with the earlier question, is that we're working to maximise Section 106 benefits, which will be language very familiar to you, may less be so to others in the room. Section 106 benefits are where developers will make a contribution towards public services, which enables some of the infrastructures to go into place: schools, hospitals, healthcare facilities. And we're making sure that we maximise those, and that's a challenge that we take through all of our integrated care partnership discussions. There's a good news story in this, and the good news story is that people want to live in Kent and Medway, and they want to come to Kent and Medway and to continue to be educated and to grow old and come for jobs in Kent and Medway. So the challenge for us is that one of the 4 aims of an ICS is to work on the economic development, and we're working very closely with Kent County Council and Medway Council to make sure that we take into account the economic development so that the infrastructure is there. So you're absolutely right, and we haven't got it all right yet, but it's really on our agenda.
Very good. Thank you for that, Paul. I think there was a woman on the right-hand side of the room who wants to ask a question. And after that, I'm going to ask the chair to wrap up.
Hiya, so my name's Sian Lambert, and previous to this role, I was a PCM business manager, and we actually had to stop recruiting because we didn't have the estate space for our Rs roles. So that's something I wanted to comment on. But there's a lot of uncertainty when it comes to PCNs who are doing fantastic things. We've seen the Rs roles here. What is the future of PCNs? There's so much uncertainty at the moment in terms of recruitment and retention, and you know, their future within the NHS. Just wondering if you could comment on that.
Paul, Kate, there we are.
So part of my answer is that to some extent we are all hostage to fortune by what national decisions are. But certainly in Kent and Medway, we see PCNs as a very important part of the future and very positive partnerships that we're seeking to develop as we develop our primary care strategy in general. So from our point of view, we're really enthusiastic to keep them going and to work with them and sort of expand the leadership that they show into the system.
Great. So thank you everybody online, in the room, and those who submitted questions earlier. It's very much appreciated. I'm now going to ask Sedi if he would like to say a few words to wrap up.
Thank you very much, Matt, and thanks Paul, Ivor, Natalie and Kate for contributions, along with Becca and Mike, of course. Every time I go out and speak to people across Kent and Medway, which I try to do as much as possible, I'm talking to them about the collective commitment that we all bring to our work every single day. We are at the start of a journey. It was really important that we had this AGM in this way for the first time, as far as I'm aware, in Kent and Medway. Paul mentioned Symposium 2 coming up next month. It's really important that we get out and talk to as many people as possible and respond to what people are telling us, what we're hearing. We've got a long, long way to go, but we are on our way.